Communication plays an integral role in every aspect of society. For centuries, humans have relied on various forms of mechanisms to disseminate and receive information. Over the years, communication has evolved to what it is today because it plays an imperative role as a process of social interaction. During this process of social interaction, people influence each other with regards to ideas, knowledge, behavior, and attitudes. Hence, there is need to communicate what cervical cancer is all about to the people. According to World Health Organization, cervical cancer develops in a woman's cervix, that is, the entrance of the uterus from the vagina. Almost all cervical cancer cases, 99% of it are linked to an infection with high risk of human papillomavirus, an extremely common virus transmitted through sexual contacts. Cervical cancer is the fourth most common cancer in women, although most infections with HPV resolve spontaneously and cause no symptoms. Persistent infection can cause cervical cancer in women. According to UNICEF report, in 2018, an estimated 517,000 women were diagnosed with cervical cancer worldwide, and about 311,000 women died from the disease. Some of the factors that negate cervical cancer awareness include poverty, illiteracy, ignorance among the professionals and non-professionals, cultural and religious practice, poor budgetary allocated to the health sector, refusal to visit the health center, socioeconomic factors that may hinder many women to visit health center, as well as partners not actively involved in their spouse health. It is on this background we'll be speaking with an expert, a gynecologist, Dr. Anima Shami from Amfa Hospital.
And my name is Goni Anima Shami, doctor. I'm a gynecologist and a senior registrar at Lagos State Island Maternity Hospital. I am going to be using some layman terms. I'm going to be breaking down some medical terms so that we can all understand what this cervical cancer is all about. Cervical cancer is one of the preventable diseases that affect the female gender. It is one of the commonest disease that is deadly to the females, and like I said, it is preventable. So this cancer, it's now in Nigeria, it's usually affects about 12,000 to 14,000 people, and they usually record for about 4,000 to 8,000 deaths yearly. This cancer affects age group of from people that are sexually active from the age of 35 to 45, but on average age of 50. This cancer is a deadly cancer, but it is preventable. The reason it is unacceptable, and the reason the federal government have decided that we should prevent this, or the occurrence of this cancer, and the best way to prevent it is by vaccination, which is the first step. That's the primary prevention. So what is this cancer about? The cancer, like I said, is the cancer that affects the cervix. Where is the cervix located? The cervix is part of the female genital part. It is located on it is the lower part of the genitalia, and it is found in all females. Now, who are the sets? What age range and who are the particular set does it affect? The age range starts from any age, any lady or any girl that is sexually exposed from age 9, from the age of puberty to age of menopause. That is the reason the federal government are targeting the age of 9 to 14, because this particular age range are the set of people that are usually not exposed to sex yet, and those are the people that would benefit from the vaccine. Now, what is this cancer about? The cancer is a cancer that is caused by a virus. The virus is called human papilloma virus. This virus has different strains. We have the strain of 16, 18, and we have other strains. But this particular strain of 16 to 18 are the ones that affect and causes cervical cancer. Now, what are the risk factors? What are the predisposing factors to this cervical cancer? We have a lot. Now, starting from the early age of exposure to sex is one of the risk factors. Going to smoking is one of the risk factors. Having multiple sexual partners is one of, because these multiple sexual partners is what will predispose you to have the virus called the human papilloma virus, and then you get infected with that virus. Once you get infected, your body system itself could either fight the disease or it could progress to become cancerous. Now, we also have other risk factors which include birth control. We have evidences that the use of oral contraceptive can predispose to having cervical cancer. So what are the symptoms of this cancer? We have various symptoms. These symptoms are limited. The major or the commonest symptoms are the fact that the woman can start having symptoms of foul smelling, watery vaginal discharge, and also she could also present with complaints of postcoital bleeding, and sometimes she could present with complaints of heavy bleeding or intermittent menstrual bleeding. These are not common, but the commonest are the first two, which are having foul smelling vaginal discharge and postcoital bleeding. How do we prevent this cancer? This cancer is preventable. It is preventable. One, preventing this cancer by making sure our girls from the age of puberty, from age 9 to 14, are given the vaccine. They are all vaccinated. That is what the federal government is planning to do with the project coming on soon. And with that, I would advise the public to please enlighten their girls, their sisters, to go for this vaccine. The vaccine is going to be free, and it has a lot of benefits. Now, it will completely wipe off cervical cancer. What are the screening modalities for? We have different screening modalities for cervical cancer. The screening modalities are, we have pap smear. We usually encourage our girls, those ones that are already exposed to sexual intercourse, to go for this pap smear. This pap smear can be done every 5 years. Once it's negative, you keep doing every 5 years till the age of menopause. Now, we could also have HPV testing, HPV DNA testing. We do that also to screen for cervical cancer. Once the pap smear is positive or it is suggestive of any of these cancer, then you go ahead, you go further for the HPV testing. Okay, so like I said, how do we treat, how do we manage people that come down with cervical cancer? Now, like I initially said, we said we could prevent it by preventing them from having it. Now, that's the first step. That's primary prevention. Now, those that now have it, what are the symptoms they have? Once they present with those symptoms, you ask or you allow them go for some basic investigations to make the diagnosis of cervical cancer. So once they are in that advanced stage, they usually come down with weakness, weight loss, loss of appetite, and with, in addition to the other symptoms of having foul smelling vaginal discharge, having postcoital bleeding. Then what do we do to them? Then we start the treatment. How do we start treatment? We have different treatment modalities. We could use use of surgical, that's surgery. We could also use of chemotherapy, radiotherapy. These are all based on the stages of the cancer. We have different stages from stage 1 to down to stage 4. How do we get people enlightened? How do the public get to know about cervical cancer? There are different ways. Like we have through the radio, the TV programs, creating awareness all around. However, people in the remote areas, okay, government, I would advise government to just make effort to decentralize the centers. We can have we can have those small centers in those villages, in the bushes around, where we can have health personnel to give them the vaccine, so that it goes round and it covers a whole wide range, and people can get vaccinated, and we can eliminate cancer, cervical cancer in the world.
Having heard from an expert the common symptoms and signs of cervical cancer and how we can prevent it, it is also important to hear from the horse's mouth, that is the survivor of cervical cancer, about their own personal experience.
I visited one of the best cancer centers in West Africa, the NSIA Youth Cancer Center in Idiaraba, Lagos.
tí n bá máa gbé nǹkan kékeré á rẹ̀ mí, ojú máa kó mi bí pé mo fẹ́ ṣubú. So mo wá ń lean, mo fún gbogbo ẹ̀jẹ̀ ara mi gbẹ tán. Nígbà tí màá lọ pé dókítà, tí mo lọ church, tí mo lọ pé pastor pray fún mi, bó ṣe ní ìmọ̀ ló bá ṣàpè nígbà tó wá dìrọ̀lẹ́ tó close ló bá ní kí n pè mí lórí fóònù pé kí n sọ fún àwọn kan ṣí gate, wọ́n ṣe ṣí gate ló bá lóun mú dókítà wá fún mi ń pé kí dókítà mi wá treat mi. Ó ní dókítà yẹn ṣe wá méjì, wọ́n parí lọ́sì méjì àti ìjọsìn ìdáhùn lọ́jọ́ tó padà sí 22 ọ̀sán tó máa fi sọ́jú bá wọn wá ní kí n ṣe ní wọ́n bá àwọn ojúṣe ní iṣẹ́ ṣe gbogbo.
Tí ìbéèrè ìbẹ̀, there was the symptom that I had. First of all, like say water dey come out from my body. So after blood come out. And I go buy medicine for infection. I buy medicine for infection, no do am anything. So I start go hospital. So they give me all the tests. They reach for the past smell test. They say they no fit do am because of the bleed. So after everything, I don't waste money for that smell and this thing. When I pay finish, nothing. They say I dey bleed. They cannot do it.
Madam, you don't pass 50 years, abi?
Yes. So after everything, you get the doctor that I met. Say I will do whether by force it will do the past smell for me. So they do am. So as a result, say it's cancer.
Like beginning of this year, like January, I dey see heat for my body. I can't go our hospital for blood. They say na infection. I treat am 2 times, you no go. I can't go another place. Say may I go Benin. Say na there they will see machine check me. Make them know till they do me. I use there, they can't send me to you. So they not get machine for Benin. They send me to here. One day they can't say na cancer. Now they treat me well. After chemo, I go for radio. After it now.
Okay, now only itching, huh? You know, see blood.
I dey see blood.
You don't pass 50 years.
No, I don't. I will be 56 now.
Okay. You never pass your menopause.
I don't pass.
Okay.
I don't pass.
You can't still see blood again.
I can't see blood. Then I can't see that after his blood they miss am. Now they say, now I got it because they say I'm cancer. Now I can't treat seriously. If this sickness dey, this vaccine will help our children. I dey in my state with this kind of vaccine, I cannot go through this sickness when I get it. See? Now to help our children, now this vaccine, make them go take am. Go help them for this sickness. But the sickness wey dey, now we get them with suffer am. Make them let our children take the job. If they feel helpful, we go happy. Because if children get am, they no go sick am. But you know if you say they not sick, they take am, they fit sick am. The money too high. Make them see, they fit give me also I like am like that. Yeah, I will find what the big one, I find the government the big one.
And the 17,400. Why the second one was because of dollar rate. Second one 22,700. So the last one now they will call me by let's say 26th of this month because the first one they will give a month after, like the third vaccine will be 3 months after. So I'm waiting for the third one, which is this month 26th of this November. So guys, to the government to provide at least support for the needy because so many people are poor and the cancer now are spreading wide. So I'll just advise the government to help to support the poor people because it's not everybody that have the money.
My name is Dr. Bashir Miriam. I work at the NSI Cancer Center. I'm a senior resident in the Department of Radiation and Clinical Oncology of the NSI Cancer Center. Alright, so once the patient is diagnosed with cervical cancer or any other cancer, really, the diagnosis is based on what we call a biopsy, which is done, and then there's a histology report. So the patient comes into our center and presents his or her histology report, and of course a referral letter from the index facility where they were sent in. Following that referral from an index facility, the patient comes into the center and then the patient is registered under a particular specialist. We have some specialists here who are particularly interested in managing cervical cancer and gynecological cancer cases. So most times there might be some preference for them to pick up the cases. So when the patient comes in the register, we do what we call in medicine clerking. That's asking the questions that, okay, when did it start? When did the patient begin to have complaints? What were the complaints? And we characterize those complaints. And we try to sort of like say possibly or ask questions that could be around what could possibly have caused this cervical cancer in this patient. So that's what the clerking involves. And after that, also on that same visit, we do a physical examination for the patient. So the physical examination involves checking the patient's body parts to make sure that we want to assess what's the extent of the cervical cancer. On physical examination, you can actually have like a clinical, we call it clinical staging. The staging tells you how far the disease has gone. So following the clinical staging of the patient then clinical staging of the patient, and that's following history and physical examination. We then request for investigations from the patient, because from clinical assessment in managing cancers, clinical assessment is not just enough to make a diagnosis for this patient. Also, we co-manage the patient with the gynecologist, because depending on when the result of the patient comes in, that's investigations such as CT scans of the abdomen and the pelvis, of the abdomen, and a pelvic MRI and chest CT scan. So those scans help us to say, okay, how far has this disease gone? And then we also call in a gynecologist to see the patient. So there be a role for surgery before or after the patient's treatment that we're going to do for the patient. So usually, most of our patients come in at a slightly advanced stage. So there's a protocol for treating that kind of case, and usually surgery might not be the first option for them to start with. So what we do is we just do chemotherapy and radiotherapy. We call it chemoradiation, concurrent chemoradiation. So when the patient comes in back with their results, that's the investigation results, we are now able to categorically stage them following the investigation results, and then we can then say, okay, so now the patient should come in for treatment. So for a classical stage, 2B cervical cancer and above, because cancers have stages from 1, 2, 3, 4. So from about the later stage 2 to about early stage 4, you can do what we call chemoradiation for them. That's chemotherapy once a week and radiotherapy once every day for about 5 weeks. So before we do that for the patients, there's also some blood tests that we do to check is the patient fit for treatment. During the clinical assessment of the patient, during follow-up and the first visit, we'll have checked and to see whether can this patient withstand our treatment. So there's clinical assessment of can this patient take the treatment, and then there's a blood assessment to see can this patient manage or take this treatment. So when we say, okay, patient is ready to take this treatment, the radiotherapy for a classical cervical case, usually, let me state that for the earlier cervical cancer cases, if it's a stage 1 or early stage 2, a surgeon plays a very critical role, and the patient may have to do a surgery that may involve removal of the womb and the ovaries. But if it's a later stage, then the classical treatment is the chemotherapy and radiotherapy every day, then chemotherapy once a week. So when the patient comes in and pays for the radiotherapy, we do what we call a CT simulation. That's a CT scan, but instead of getting the report for the CT scan, it's a simulation of a CT scan. It's like a mimic of a CT scan that we're going to use to treat the patient every day. So the image comes up on our system, and then we plan the treatment with the help of the oncologist and the physicist, medical physicist. And then within maximum of about 10 working days, the patient starts treatment. So the treatment is for 25 working days, that's 5 weeks. So the treatment usually is in 2 components. So for radiotherapy, there are 2 components. There's external beam radiotherapy. That's where the radiation comes in from an outside source, a far source. We call it teletherapy. Anything tele is a long distance. Then there's a short distance radiotherapy we call brachytherapy done after the external beam radiotherapy. So usually at about the external beam radiotherapy is 25 working days. So usually at about day 21, 20, or even earlier, day 15, 16, we can request for a pelvic MRI about the, let's say 16, 17, a pelvic MRI into day 20, so that we can see how well the tumor has reduced following the radiotherapy. And then we can then plan the patient for the brachytherapy treatment, because there's a time period during which all the treatment has to be completed. Also, the dose of treatment we are going to give to some certain parts of during the treatment, it's determined by so many wants to see on the investigation results. So as much as possible, we personalize the treatment of our patients. Every patient doesn't get the same particular dose because of certain intricacies. Basically, managing cancer patients, it varies from person to person. So once we have done the external beam radiotherapy and patient has done an MRI, because patient repeats an MRI again, and then we say, okay, patient is fit for brachytherapy.
The role of oncology nurse in the treatment of cervical cancer cannot be overemphasized because they are saddled with the responsibilities of supporting patients through the side effects of cancer treatment. I was able to interview one of the oncological nurses who talked about the process of how cervical cancer survivors are being treated after being diagnosed, even though she was extremely busy and not wanted to talk to me.
So they will fix this instrument inside them. You understand?
Yes,
and they just thread them it's called a tandem.
Okay.
With ovoids, like a stop. They will fix it
Inside this vagina.
They will cut them. They will fix it. We fix it. They pass it. The patient will be sedated. Anesthetic will be given. Anesthesia will be given to the patient. The patient will not feel the pain. So they now put her as if you're in theater. They now call anesthesia, and then they start passing the instrument. That
Instrument.
Just fix it into her for the fixing
instrument.
And that thing is through where radiation can be given. So they fix radiation tubes to them. There's a source inside there. That is the source they give it. Everybody takes that source. Because what the main thing they come for is for radiation.
The role of radiation therapists in the treatment of cervical cancer cannot be overlooked because they operate with machines, such as linear accelerators, to deliver concentrated radiation therapy to the region of a patient's tumor when treating cervical cancer. Other departments that are also involved in the treatment of cervical cancer are the physicist, the chemotherapy session, and the CT scan session. I was privileged to interview a radiation therapist, and he showed me different equipment used in the treatment of cervical cancer.
Now, we are going to put the source directly to the tumor. The tumor will shrink, just remain small. Then we now use this just this is what called IV radiotherapy. Like this setup you are seeing, we are doing that at the setup in South Africa. So we are just focused to come to this place. So we will now put the application on the patient such a way that on the dose is going to go directly to the remaining small tumor to complete the remaining 25.
Cervical cancer is one of the most treatable forms of cancer as long as it is detected early and managed effectively. Just as we've heard from Dr. Mariam Bashir, a senior registrar, Department of Clinical and Radiation Oncology, LUTH, cervical cancer diagnosed in late stages can also be controlled with appropriate treatment and palliative care. Frequent medical checkup among women should also be prioritized. My suggestion to the federal government is that the federal government should allocate enough funds to the health sector, collaborating with NGOs, medical sectors, and the media to give adequate information about cervical cancer, making the pap smear test affordable to the masses, and also equipping the local health center with the necessary facilities in order to reduce the rate of preventable diseases such as cervical cancer. Together we can all improve good health and well-being of the people of Nigeria.